Only 43, look 53. What should I have done? I am only 43 and I look way older. I have deep forehead wrinkles, loss of volume, crow's feet, droopy eyelids, and deep lines around my nose. I'm scared of surgery, but if recommended, I would definitely consider it. I have had all therapy once. I really did see a difference around the jowl area, and also had Botox 3 times in forehead. I had really heavy eyelids. They are not pretty, but I have a beautiful smooth forehead. So last 2 times stuck with 11s and brow lift with Botox and was happy, but hate the forehead.
Thank you for your question. In your question, you stated you're 43, but you look 53. And you've gone into some detail of some procedures that you've done that are non-surgical, including Botox, and certainly you're very focused on the horizontal forehead lines. So in trying to determine a solution to help you look younger, in our practice we start by first understanding why does someone who is younger look a little bit older. Many times it's the genetics, such as lighter skinned people with light colored eyes often tend to have fine lines and wrinkles a little bit earlier than people with darker skin. This has to do a lot with the skin in the terms of the dermis, the backbone of the skin. People of African descent tend to have very, very thick quality to the skin, and so there's a difference there. But the other things we always ask about, which you can't change your genetics, but we can change other things that might contribute to the aging process. We ask about whether or not you smoke, whether or not you've been under a lot of stress, what's your diet like. The point is that healthy aging does require healthy lifestyle. And so the foundation of proper sleep, good diet, exercise are critically important, because no matter what we do in the cosmetic surgery world, you cannot help somebody to their full potential if they have toxic influences in their life. So let's start with you answering that for yourself, so that maybe you can make some lifestyle changes. In my practice, I do a lot of eyelids, I do a lot of facelifts, and I recall a patient of mine who was a long-time smoker, and she actually wanted to have a facelift, and I said that I wasn't going to do a facelift unless she quit smoking, and to prove it, we actually do serum nicotine tests to ensure that. Because with a lot of surgeries, the healing process is going to be negatively impacted by smoking, in particular facelifting. Well, to make a long story short, she did stop smoking and she chose a very holistic and healthy lifestyle, and it was remarkable that within a few months her skin looked so much more vibrant and she looked really healthy and she felt fantastic. So always amazes me how the human body is so resilient. And when you make these lifestyle changes, you can really have an impact on your appearance. This is actually a time when a lot of people who are in the middle decades of life, let's say the 40s and 50s, are looking a lot younger because of these benefits. So in a weird way, we have this very indeterminate age population where people who are doing the right things with their health and well-being, and then on top of that doing aesthetic procedures to even further enhance their appearance, can really look decades younger than their age. Now that brings us to the next issue, is what are the elements of the face that bother you the most? Clearly it's your mid to upper face that bothers you. You have some hooding of your upper eyelids, and you're concerned, of course, about the horizontal lines and the number 11s. Well, one thing that you may not have realized is that when a person has hooded eyes, in other words, the skin over their eyes is increased in volume as a contribution of stretching, as well as the brows may be slightly descending. you unconsciously raise your eyebrows to be able to see better and to relieve the eyelids of that physical weight. It's a typical unconscious thing, and we often see that when someone, if I hand a patient a mirror and I relax their forehead and they put the mirror to their face, they raise their eyebrows automatically. And it's because they're used to doing that. It becomes something that's an unconscious drive. So, in patients like you, I've actually done two things. What I would do is I would do an upper eyelid blepharoplasty to relieve the hooding on the eyes to improve the appearance so their eyes look brighter, because eyes that are very hooded look very tired, and it creates the look of aging. So it may really help you address the first issue of looking like you're 53 when you're 43. And then concurrently, I will do a little Botox in their forehead to relax the horizontal lines. That helps extinguish the habit. What happens even after you do the upper eyelid blepharoplasty is that a lot of people will persist on raising their eyebrow because they built up this habit. Well, when you Botox that area, now that the brows are in a better position and you don't have the horizontal lines, the hooding of the eyelids will no longer be present. And so that's part of the reason why when you have Botox and you have hooded eyes, people who are aware, doctors who are aware, will not inject the horizontal lines. Because if you inject the horizontal lines, the brows just drop, and you can't. Then your eyes look even more hooded. So, with that concept in mind, it might be worth considering an upper eyelid blepharoplasty to help you with this upper face rejuvenation. I think that you have explored non-surgical options, but for the level of hooding that you're experiencing, you're not going to get that much of an improvement with any of the radiofrequency devices or any of the other non-surgical options. So consider upper eyelid blepharoplasty and think about the other things I mentioned about the lifestyle changes that might be contributing to your appearance, and discuss this with the doctors that you have been visiting. So I hope that was helpful. I wish you the best of luck, and thank you for your question.